This is Unit 5 of Diet 111, our last unit, and we'll look at nutrition through the lifespan, beginning with Chapter 14 today, nutrition during pregnancy and lactation. I think it is important that we acknowledge that we are not the leader in good care of pregnant women. You can look at a number of different indices of this, infant mortality, of course, being one of them. And here you see our numbers are higher than comparable countries. You can also look at the Health Explorer for specific information on Philadelphia. One of our concerning statistics is we have high rates of women who have no or late prenatal care. Maternal mortality in the United States, again, is not meeting targets, and we also see racial disparities in these outcomes. This is never, ever a good thing. So in light of that, when we look at nutrition during pregnancy and lactation, we absolutely should not make the assumption that we are doing wonderfully in this area. Let's start with prenatal development. A quick look at this here. As far as its connection to this course, what you need to understand is that this is an astounding amount of development that occurs in 9 months in a being that is entirely dependent on getting its nutrition from its mother. So how does that impact the importance of nutrition in pregnancy? It underscores the importance for a number of different reasons. It's important that a pregnant woman has adequate stores, has good eating habits, has a healthy body weight, and is well nourished early in pregnancy so she grows a healthy placenta. Ideally, then, good nutrition should begin before pregnancy, during childhood and adolescence. That would be the optimal situation. Think a little bit about what you believe is most important to tell your pregnant patients about. What do you think is the most important information they would need if you had about 10 minutes to talk to them? We focus a lot on weight because weight is an indicator of health risks. We've historically focused more on low birth weight, and you can see the reasons here. Babies that are born at a low birth weight, usually defined as less than 5.5 pounds, are at greater risk, both for short-term and long-term health conditions. And although this may be due to a mother's poor nutrition, there are a number of other factors that can be determining. Now we have a newer situation, and I'd like you to definitely listen to this video. It's a very nice one, short, but covers the problem of mothers gaining much too much weight and having very large babies. Babies are always cute, and I in class we have students who say, "Oh, but the baby's so cute." True, babies are cute, but this is not a good health factor for this baby. This baby is at greater risk for a number of health problems, not only very early in life, but also later. Equally important is the health of the mother, and mothers that gain excessive weight are more likely to then have health problems associated with that weight. We've learned in this class that it's not easy, it's not a simple thing to lose weight after you gain it. Your body defends that extra weight. So this sets up these moms who have overgained to have struggles with their weight and associated health problems. And that's why we have these weight gain recommendations. They're based on your BMI before pregnancy, and you absolutely will see them on the tests. So know the recommended weight gain for underweight, normal weight, overweight, and obese. Very important. If someone gains appropriately, all that weight is accounted for and very little is fat. That's important for women to understand. They shouldn't be afraid of gaining healthy amounts of weight. The pattern of weight gain is also really important for kind of sending up red flags. One of the areas that I think is precarious is the first trimester, the first 3 months of pregnancy. Ideally, only a few pounds should be gained over the entire 3 months. Because of a number of things, nausea, emotions, family members pushing food upon them, women can gain far too much in that first 3 months, and then they're out of their recommended range. We don't recommend loss, but we do encourage that the diet is tweaked to bring it closer to actual needs. Inadequate gain is also a concern. Many times women don't gain according to these set ranges, and yet everything is absolutely fine. But once again, it can be a red flag to look into this further. Definitely look into the nutrient needs of pregnancy. And what you will see is that many nutrients increase. Look at the green bars here. And most increase much more than the calories increase. So I want you to take note of this. In the first trimester, a woman needs no extra calories added to the pre-calorie or the pre-pregnancy need. Second trimester, only 340 calories above non-pregnant levels. Third trimester, only 452. This means that if a woman needed 2,000 calories before pregnancy, she needs 2,000 calories in the first trimester, 2,340 in the second, 2,452 in the third. Those calorie levels are really low, and nothing like the idea of a sundae and an extra order of fries and snack, snack, snack all day long. Basically, a snack of a sandwich, an apple, and that's a small sandwich, and a glass of milk will provide the calories. So look over this and this. Read all the notes over here. One area I'd like to bring to your attention, you'll see here that the calcium needs of a pregnant woman don't increase above the calcium needs pre-pregnancy or non-pregnant. This is because calcium absorption increases dramatically during pregnancy. If a woman's meeting her calcium need, for a non-pregnant woman, she doesn't have to increase it. Her body takes care of that. So what this means is calories go up very little, nutrients go up quite a bit. A healthy diet for a pregnant woman is very nutrient dense, about a serving, if that, from the healthy food groups. No extra dairy, okay, meaning if you're meeting your need non-pregnant, you're meeting your need pregnant. Very little in the way of extra protein. Okay, see here, it's basically an ounce or so. No extra fruit. About a cup or so of extra vegetables. And about a serving or two of grains. 2 slices of bread, the little sliver of meat, and a vegetable, some carrot sticks, just about does it. Because so many vitamins and minerals are needed at higher levels and calories are stringent, the prenatal supplement is often recommended, commonly recommended. This doesn't fix a horrible diet, but it does give the pregnant woman some backup to make sure she's getting enough of these vitamins and minerals. Physical activity is recommended with some caution, so read over this. Many pregnant women are told to just lay down and rest. This is not healthy for the woman. A fit, well-exercised woman within her limits actually does better during labor and delivery and loses the weight and rebounds more quickly to health or a normal health status after she delivers. We have food assistance programs. You must understand what the WIC program is. Do a little bit of reading about that and watch the video. If nutrition is so important, we need to know how to recommend programs to fill in the gaps in our clients' diets. Okay, some problems during pregnancy. Definitely watch this Kaiser video. This is very, very important. A great look at gestational diabetes. It tells you basically everything that you need to know. read and understand hypertensive disorders from your textbook. There are more common nutrition-related concerns like cravings and morning sickness. They are fairly common, might not be an issue nutritionally, can be an issue nutritionally if the individual is eating a very poor diet because of these. Know what pica is? It's a unusual craving for food or non-food substance. It may or may not be an issue depending upon the specific craving and the amount. We already looked at the craving for ice. That might be an indicator of an iron deficiency. Because of a change in hormones and the growing fetus, what we see is that heartburn and constipation are very common. The recommendations are the same as for a non-pregnant woman. Smaller meals, avoid irritants, more fiber, fluid, exercise. Don't stop taking the prenatals because of constipation. Perhaps take smaller doses. Avoid cigarette smoking is really important. Watch the video on that. As a nurse or dietitian, you'll be giving out nutrition and health advice. And alcohol is the #1 cause of preventable birth defects. We now know that not only large amount of alcohol, as you're seeing here, the impact of that causes fetal alcohol syndrome. We know that smaller or episodic amounts of alcohol, binge drinking, lesser amounts, also can cause some neurodevelopmental problems and birth defects. So the best advice, the American Medical Association advice, is to avoid alcohol beginning when you plan, if you plan a pregnancy, but certainly throughout the pregnancy. There's also evidence that if you're planning a pregnancy, alcohol intake by the father is also important in that he should limit. Okay, what to avoid during pregnancy is outlined here. Take note that energy drinks have very high level of some vitamins and caffeine, not a good thing. Caffeine in high amounts early in pregnancy is correlated with a higher risk of miscarriage. Note the caution around certain types of fish as well. Definitely read these charts. Food safety during pregnancy. There's also a foodborne illness, listeriosis, and I'm trying to find this here. Here it is. Don't eat hot dogs and luncheon meats unless they've been reheated to steaming hot. That is because of listeriosis. As far as pregnant teens, they are still growing. They have high nutritional needs, and then the needs of pregnancy superimposed on that, so they are considered high risk and shown to have more adverse outcomes. So we want to give them some special care and special education. This chapter also covers infant feeding. And we're talking about infant feeding, we're looking at the choice basically between breastfeeding and formula feeding. Now, when we look at nutrition of the infant, we may think, how can we mess up? You know, it's a tiny, tiny baby. How can we go wrong? But in these LinkedIn articles here, there is some information about how we do go wrong. We begin solids too early. We force the baby to finish the bottle. We don't give the babies adequate tummy time. We begin sweets too early. So there's a lot to learn about this, but I did want to mention something that's very, very important. When we're talking about nutrition of the child, it becomes a very, very sensitive area because, generally speaking, the vast majority of parents are trying their darndest to do their best. They are trying within their means, their abilities, to provide the best they can for their child. So we need to counsel and educate with a great deal of sensitivity, and at the same time to provide evidence-based recommendations. We also sometimes have a generational defense in that the generations that have come before us say, well, we never did that and you turned out just fine. Okay, we can come up with some good responses to that, and perhaps we'll have a chance to talk about that. But we need to make sure that individuals know this is a different time and place with different issues. So these recommendations we're making are based upon the best evidence. Look through this. You can see here that infants need a whole lot of energy based on their body weight. More fat too. When we look at these growth curves, this is really important in assessing an infant's growth. We're not expecting that all infants grow at the middle of the curve, but what we do become concerned about, and this actually goes beyond infancy into childhood as well, we become concerned when we see a big change in the growth, so that an infant perhaps who is growing along the 40th percentile drops down to the 10th or hops up to the 80th. Then we want to dig in, ask some questions, see if anything's going wrong physically, socially, nutritionally. Okay, I'm going to leave it up to you to read about breastfeeding and its benefits. There are so many, both for infants and the mothers. Not only does the breast milk provide immune factors that decrease the risk of childhood infections, we also see lower rates for very serious diseases, not only of childhood, but throughout the life. So read through the benefits for infants. Also read through the benefits for mothers. Mothers have lower rates of a number of diseases, including type 2 diabetes, breast and ovarian cancer. For many mothers, this works well and it's enjoyable. For other mothers, it's a struggle, and that may have to do with time, that may have to do with support. One of the very important professionals, and I may have mentioned this in our welcome discussion, the announcement to that, is the lactation consultant. And I'm looking where I have that. I have that linked in. Drexel has a human lactation consultant program. There are a lot of things, there are a lot of bumps along the way if you choose to breastfeed a child. It doesn't always come naturally. There are many things that can happen that scare mothers. So it's essential to have a support person who knows how to advise, recommend, give tips, etc. Definitely watch the links and read through and understand the terminology. And there is the link to Drexel's program. The mother does best if she's well rested, well hydrated, and well nourished. And you can see nutritional needs for a woman who decides to breastfeed stay quite high. Even calorie needs. Okay, so even drawing upon fat stores, you can consume some extra calories and still lose weight. So this is important, a healthy diet during lactation. You can look at micronutrient needs as well. So formula has been designed to be as close to breast milk as possible. Okay, you're not harming your child by feeding the child formula, but the baby and the mom are certainly not getting all the benefits of breastfeeding. The formula does not have the immune factors that the mother secretes in her own breast milk. Some babies should be formula fed, and that would be to prevent the transmission of HIV/AIDS and active TB in the case of some genetic abnormalities, and perhaps to prevent the transmission of some necessary medications the mother might be taking. So this is a very important discussion to have with the physician. Right? Nursing bottle syndrome. This is something that parents need to be educated about. Babies who are put to bed with a bottle that is a fluid rich in carbohydrates can develop this horrible decay. When can a baby be transitioned to cow's milk? The current recommendation is not until 1 year of age. And then at 2 to 5 years, moving down to lower fat. This is starting to be discussed a little bit, and you'll see the link here. They're not finding the negative health impact of full fat dairy as we assumed or believed. So I'm not sure what's going on there. It might be that individuals consuming more full fat dairy consume less very unhealthy fats in their diet, but there's an article linked up for you here. You don't want to introduce cow's milk too early for the reasons listed. And I would also say it's important to understand that if a mother breastfeeds for a couple of months, what she should then transition to is formula until 1 year of age. And that's it. We'll talk about childhood in our next lecture.